Hey, it's me, Autoimmune Warriors here, and today on Makeup and Maladies, we're going to talk about Hashimoto's disease. I chose Hashimoto's disease, if I can say it right. I chose Hashimoto's disease as my second thing to talk about because it is the second most common autoimmune disease in the United States. It's also something that I have. So we are going to dive into that today, throw on a little makeup to match my wonderful mustard sweater here. So Hashimoto's disease is an autoimmune disorder that causes an underactive thyroid. Before I go any further, I just want to say that I have my mirror here, which you can kind of see in the corner. Sorry, I can't do anything about that right now. And I also have some notes. Part of Hashimoto's is memory problems. And oh boy, do I have that in spades. So I can't memorize a script and I can't memorize too many details at once. So I will be looking down from time to time. I apologize ahead of time if that is distracting, but that's just what I have to do to get you the information. So here we go. With this disease, your immune system attacks your thyroid by sending antibodies to attack it. Your thyroid is a butterfly-shaped gland right here in the front of your neck. You might be able to see that mine still looks a little swollen. We're still working on getting my levels to be what they should be. So it still looks a little big. So yeah, your thyroid gland is right here in the front of your neck. It's a butterfly gland on both sides of your throat, like this. When your thyroid becomes damaged, you can't make enough hormones to make your body work properly. Almost every function in your body is affected by your thyroid hormones in some way. So it's really important to have that working properly or to be on medication that helps it work properly. Like I said, Hashimoto's disease is the second most common autoimmune disease in the United States, where it affects 5 out of every 100 people. That's a lot of people. Woo! I know I said this in the last video. I have such weak muscles that even just bouncing my face with my puffer hair, my beauty blender, it is exhausting. So I have to literally like hang my arms down and shake them out. Otherwise I get painful spasms and electrical shocks. Give this video a thumbs up if you have the same thing. Hashimoto's disease is at least 8 times more common in women than men. Although you can get this disease as a young woman or even a teenager. Typically, it shows up in women between the ages of 40 and 60. Your chances of having or getting Hashimoto's increase depending on like family history and genetics and stuff like that. You are more likely to develop Hashimoto's disease if you have other autoimmune diseases. Oh, it's like that might be a problem, but... Some examples of those autoimmune diseases are Addison's disease, autoimmune hepatitis, celiac disease, lupus, pernicious anemia, rheumatoid arthritis, which we talked about last week, Sjögren's syndrome, type 1 diabetes, and vitiligo. Some of the common symptoms of Hashimoto's disease are things like tiredness, weight gain, trouble tolerating cold, 100% true, joint and muscle pain, constipation, thinning and drying of your hair, heavy and irregular menstrual periods, depression, memory problems, and a slowed heart rate. Researchers aren't sure why people get autoimmune diseases, and Hashimoto's is no different. All they know is that you have some genetic markers associated with Hashimoto's, but other than that, it could be something as simple as a virus that triggers it. Hashimoto's disease is let me start over. Hashimoto's disease is when your immune system makes antibodies that attack your thyroid gland, and they send large numbers of white blood cells called lymphocytes, which are part of the immune system, and they build up in your thyroid. So these lymphocytes make the antibodies that start the autoimmune process. That eventually destroys your thyroid. So you've been feeling like crap. You don't feel good. You're tired all the time. You're feeling sluggish. You know something's wrong. You go to the doctor. What do? Well, first, they're going to start with a medical exam. They're going to give you a good look over. They're going to probably do this thing to your thyroid gland where they like massage it and feel it. They're searching for a goiter. They're trying to feel if your thyroid gland feels normal or is inflamed. Then you're probably going to get some blood tests to find out if you have hypothyroidism. They're going to be looking for anti-thyroid antibodies known as thyroperodaxis antibodies, or TPO. Almost everybody with Hashimoto's disease has those. Sometimes your doctor will order an ultrasound of your thyroid to kind of take a look and see what damage has been done. When my endocrinologist did that, my thyroid looked like Swiss cheese. The antibodies had eaten holes all throughout my thyroid. It was basically destroyed. It was not working properly at all. The ultrasound is also to rule out things like thyroid nodes or cancer. So some of the treatments for Hashimoto's is medication. Excuse me. Medication depends a lot on your age, your weight, your height, the severity of your problems, and what other health problems you are having. I, for instance, take levothyroxine. A lot of people take levothyroxine, but almost everyone is at different dosages because everyone's situation is just a little bit different. Once you start your treatment, your doctor is going to want to monitor your TSH levels probably every 6 to 8 weeks until you get your levels under control. And that can take many, many months. So as your doctor monitors your TSH, they're also going to monitor your goiter. If you have a really large goiter, it might not ever go down, and you might have to have thyroid surgery to remove it. All right, well, there you have it. There's Hashimoto's disease. You know, it can sound really overwhelming when you find out you have an autoimmune disorder, but a lot of them are manageable, and Hashimoto's is one of them. With a little medication and a little diet monitoring, you can really live a very normal life. So thank you again for joining me on Makeup and Maladies. And if you like this and this is something that you're into, please give it a thumbs up and subscribe. We'll see you next week.